Hi everyone, this is Prachi. I'm a certified childbirth educator and lactation educator from Kappa. And today I'll be talking to you about all the important aspects of breastfeeding that a new mother should be aware of. So, in this video, I'll be covering four topics. First topic will be importance of skin to skin. Second is how much and how often to breastfeed. Third is baby's hunger cues. And fourth is various breastfeeding positions. So now let's start with skin to skin. So it's a contact that is usually referred to as the practice where a baby is dried and laid directly on the mother's bare chest after birth, both of them covered in a warm blanket. Skin to skin contact can also take place any time when a baby needs comforting or calming and can help boost a mother's milk supply. It is vital in neonatal units where it is often known as kangaroo care. And where it is often known as kangaroo care. So, do you know the benefits of skin to skin? Well, it helps in calming and relaxing both mother and baby. It also regulates the baby's heart rate and breathing and help them better adapt to life outside the womb. It stimulates digestion and an interest in feeding. It regulates baby's temperature as well. It enables colonization of the baby's skin with the mother's friendly bacteria, thus providing protection against infection. It also stimulates the release of hormones to support breastfeeding and mothering. Do you know that the mother's nipples smell of amniotic fluid? And yes, it helps the baby establish a latch. The colostrum also tastes like amniotic fluid. Now I'll show you a picture between the mother and baby having skin to skin. So in this picture you see that the baby is lying on the mother's chest. They both are bare chest and they are covered in a warm blanket. And see how the baby has snuggled to the mother. Baby has fed well and has fallen asleep on mother's breast. Okay. Now let me take you to the second topic of today's video, which is how much and how often to breastfeed. So once the baby is born, your breast milk is all the baby needs. No water, no honey, etc. On day 1, the size of your baby's stomach is that of a cherry and the baby needs typically between 5 and 7 ml per feed. And then by day 3, the stomach size increases to that of a walnut and the baby needs between 20 and 27 ml per feed. By end of week, the size increases to an apricot and the stomach can hold between 45 and 60 ml. And by the end of 2 weeks, the size is that of a large egg and the baby consumes between 60 and 150 ml per feed. And I'll just again show you a picture which will help you understand the size of baby's stomach. See, this is the picture that you can see. Now, this is day 1 when the baby's stomach size is that of a cherry. Okay, this is somewhere between day 2 and day 3 when the size increases to that of a walnut. See, just this much. Okay, and by the end of 1 week, the size increases to an apricot and the stomach grows from this big to this big. Okay, and by the end of 2 weeks, like between 15 and 30 days, the size gradually increases to that of a large egg. Okay, and here the stomach can hold anywhere between 65 to 180 ml. See, newborn babies breastfeed at least between 8 and 12 times per day for about the first month. Breast milk is easily digested, so the newborns get hungry often. And frequent feedings help stimulate the milk production of the mother during the first few weeks. So more feedings equal to more milk supply. So in the first few weeks of life, breastfeeding should be on demand. That means when the baby is hungry, you need to feed your baby. And the duration is between 1 hour to 3 hours. So as the newborns get older, they'll nurse less often and they may have more predictable schedule. In any case, newborns should not go more than 4 hours without feeding even overnight. And by the time your baby is 1 to 2 months old, he or she will probably nurse 7 to 9 times a day. And how often do you count the time between the feedings? See, you need to count the length of time between feedings. That is, from the time your baby begins to nurse rather than at the end to when your little one starts nursing again. In other words, if your doctor asks you how often you're feeding your baby, you can say about every 2 hours. If your first feeding started at 6 a.m., the next feeding was around 8 a.m., then 10 a.m., and so on. Especially at first, you might feel like you are nursing round the clock, which is very normal. Soon enough, your baby will go longer between feedings. And how long does the nursing take? Do you know? See, newborns may nurse for up to 20 minutes or longer on one or both breast. And as the babies get older, they get more skilled at breastfeeding and they can suckle more and they can hold more milk in their stomach, their tummy. Okay, and that time then the babies, when they grow older, that means after a month, 2 months, okay, they may take about not 2 months exactly, after 3 months they may take about 5 to 10 minutes on each side. So it basically depends on the baby's hunger, how hungry the baby is, and how fast the baby is able to swallow, and with what speed the milk is flowing. So it actually depends on you and your baby and other things, such um, as I said, whether your milk supply has come in. So this usually happens between 2 and 5 days after the birth. Earlier, 1 day, 1 to 2 days is the colostrum. And second is your let down reflex. Let down is something that causes the milk to flow from the nipple. This is called let down reflex. So whether it happens right away or after a few minutes into feeding. And how whether your milk and the third factor is whether your milk flow is slow or fast, and whether your baby has a good latch, whether the baby is taking in as much as possible of your areola, and another factor is whether your baby is sleepy or distracted. Okay, so I hope that by now you are well aware of the feeding pattern in babies. We talked about the frequency of feeding, we talked about how much you have to feed your baby, we also talked about the stomach size of baby, we also talked about the length of time at each feed. Okay, so I hope that you are aware of the baby's feeding pattern. So now let's switch to the third topic, which is hunger cues in infant. So babies, as you know, should be fed when they indicate hunger. Okay, and crying is a late indicator of hunger. So breastfeeding is much easier for both mom and baby if mom is able to pick up on the baby's hunger cues as early as possible. And hunger cues should be early, active, or late. Okay, so for example, early hunger cues are smacking or licking lips, opening and closing mouth, sucking on lips, tongues, fingers. And active hunger cues include rooting around on the chest of whoever is carrying the baby, trying to position for nursing either by lying back or pulling on your clothes, fidgeting or squirming a lot, hitting you on the arm and chest repeatedly, and fussing or breathing fast. And late hunger cues are moving head frantically from side to side and, of course, crying. So, at this stage, see, it is important to calm down your baby before feeding. You can do that by cuddling your baby, doing skin to skin with the baby, talking to your baby, stroking your baby. So, I'll again show you a picture that depicts the hunger cues of infants. So this picture has various expressions of babies. So when you see them, you'll be able to know whether they are hungry or not. So now this is the picture. Okay. So these are the early hunger cues that you see. So here in the first picture, the baby is stirring, that is moving a little. Okay, this is the earliest sign of hunger. And here again in the early hunger cues, it is that the baby is opening its mouth. Okay, the baby is opening its mouth in between. And another early hunger cue is the baby is turning its head for feed, and this reflection is also known as rooting. Okay, and mid cues of hunger include stretching. The baby is stretching its legs, the baby is stretching its arms. And here another one is increase in the physical movement of the baby. The baby's physical movements, they start to increase. So don't misunderstand it with playing. The baby is not playing actually. The baby is hungry. That is why the baby's physical movements are increasing. And third is that the baby is bringing its hand to mouth. And see here, the baby is suckling its wrist. Okay. And the late hunger cues are, see here the baby is really crying out of hunger. The baby is really hungry. And here the baby is agitated. So here in the mid cues, the baby's physical movements have increased. And here the baby's physical movements are agitated. The baby is really agitated. Okay. And here the baby is turned actually red out of hunger. The baby is crying a lot and the baby is really agitated. So these are the various hunger cues that you can see. Okay. So I hope that by now you're well versed with the hunger cues. Okay. Now let me take you to the fourth topic, and a very important topic, and also it is the last topic of our video, and it is various breastfeeding positions. So different breastfeeding positions, they work better for different mothers. So one breastfeeding position may work for you and another may work for you. So it depends on the mother and baby. So from football hold to cradle hold to laid back, these are various breastfeeding positions that the nursing mothers always want to know about. So let's see how we hold a baby when breastfeeding. So you start by placing your baby on one side towards your breast. Make sure that the baby's whole body is facing your breast with his ear, shoulder and hip in a straight line. You don't want your newborn's head turned to the side. It should be straight in line with the body. You may also use a nursing or regular pillow to bring your baby to a height that makes maneuvering him to the breast easier. So now let's look at the first position, which is cradle hold. To breastfeed the baby in a cradle hold, do this. So while I explain the positions to you, I'll be making use of this soft toy. So let's consider this soft toy as a baby. So while I explain the position to you, I'll be positioning this baby, this soft toy, in various breastfeeding positions. Okay. So we are discussing the cradle hold position now. So what happens in the cradle position? So you position your baby so his head rests in the bend of your elbow. So this is the bend of your elbow. Okay. So his head rests in the bend of your elbow like this. Okay. Like this. Okay. And your hand, this hand needs to support the rest of the baby's body. Okay. Okay. And you cup your breast with the other hand. This is my other hand. Okay. I'll cup my breast with this hand. Okay. Placing your thumb above the nipple and areola at the spot where your baby's nose will touch your breast. Your index finger should be at the spot where your baby's chin will make contact with the breast. Lightly compress the breast so that the nipple points slightly towards your baby's nose. Your baby is now ready to latch. Okay, so this is the cradle position. So coming to the next position, which is the cross cradle position. See, before I move on, I also want to show you one picture of cradle hold. So here you see this is the cradle hold position. So the mother, this is the mother's hand and the baby's head on the mother's breast, and the baby's head is resting on the mother's elbow bend, and here the mother is using both the hands to support the baby. The mother is not using one hand to support the breast. So the mother is comfortable in this position. Okay? Now moving on to the cross cradle position. So to breastfeed the baby in a cross cradle or crossover position, you have to hold your baby's hand opposite to the breast you'll be nursing from. So I'm nursing from this breast. I'll hold the baby from this hand. Okay? Rest your wrist between the baby's shoulder and blades, your thumb behind the baby's ears, okay, and cradle the neck of your baby, allowing for his natural movement. See, I'm holding the position, so my one hand is free. Now using your free hand, cup your breast, okay, cup your breast as you would do for the cradle hold. So I hope you've understood this cross cradle position also. It's simple. Just hold your baby with this hand, with one single hand, okay, supporting your baby, bringing the baby to your breast. You can use this free hand to support your breast and establish the latch. I'll also show you the picture of this cross cradle position. See, the mother is using this hand to support the breast, and with this hand the mother is holding the baby. Okay. Now let's come to the third position, which is known as the clutch hold or the football hold. So this position is useful if you've had a C-section and you want to avoid placing your baby against your abdomen. And if you also have large breasts, this position is helpful. If your baby is small or premature, or if you've had twins. So to breastfeed a baby in a football position, you have to position your baby at your side. Okay? Facing you. Facing you. Facing you, and the legs. Baby's legs tucked under your arms. Okay? Like this. Okay? And so everybody is on the same side. Your hand, the body, your breast and baby's head. Okay? And support your baby's head with the same hand as I said, and use your other hand. This is my free hand, and I'll use this hand to cup my breast as I would do in cradle or cross cradle. I can just cup my breast like this. So see, this is again a very easy position. If you have a good command on this position, it is very comfortable for you and the baby, especially if you have twins and you have a C-section. So I'll show you a picture as well for your better understanding. So see, this is the football hold position. As you can see, these are the twins. You will just be able to see the baby's head because their body is under the mother's arms, and the mother is feeding both the babies simultaneously. So no baby has to wait. Okay, both the babies can be fed simultaneously in a football or clutch hold. Okay, and now the fourth position, which is the laid back position. So this position is particularly helpful for moms who have smaller breasts, and for newborns or babies with sensitive tummies or excess gas. So to breastfeed a baby in a laid back position, you have to do this. So you have to lean back. you have to lean back really well on a bed or a couch. See how I'm leaning? I'm just leaning back very comfortably. This is a chair though, but you can use a bed, or you use a recliner, or you use a comfortable soft couch. Okay, so you're leaning back on a bed or a couch, well supported with pillows in a semi reclining position, so that when you put your baby tummy to tummy, this is my tummy and this is my baby's tummy, okay, with his head near your breast, okay, gravity will keep him molded to you. Your baby can rest on you in any direction, like this or like this, whichever way, okay, as long as the whole front of your body, of the body of the baby, is against your body, okay, and the baby can reach your breast properly. Your infant can naturally latch on in this position, and you can help by directing the nipple toward your little one's mouth. I can just help my newborn, okay, by directing my nipple. So once your baby is set up at your breast, you don't have to do much besides just uh, laying back and relax. So here, if you see, I'm just holding my baby with one hand, and with the other hand I can just read my book. I can have a cup of coffee. I can use my remote to watch television, do whatever I want. And this is a very comfortable position for mothers. Okay, I'll show you a picture as well of a laid back position. So this is the mother. She is lying back and the baby is resting on the mother's chest and suckling. Okay. Now coming to the last position, which is side lying position. See, this position is a good choice when you're breastfeeding in the middle of the night. So to breastfeed a baby in a side lying position, both you and your baby should lie on your sides, tummy to tummy. Use your hand on the side you're not lying on to cup your breast if you need to. When using this position, there should be no excess bedding around the infant that could pose a suffocation hazard. Okay, so you shouldn't be doing it on a recliner, couch, or waterbed. So I'll again show you a picture that depicts a sideline position. So in this picture, you see the mother is lying on the bed and she's resting her head on one hand and holding the baby in another hand. Very comfortable position if you are feeding during night, or if you have had a C-section also, this position is very comfortable. There is no pressure on the abdomen at all, but you need to be a little skilled at this position. Okay, so initially you may want to take the support of some pillows or some blanket that you want to put at your baby's back so that the baby does not turn the other side. All right. So so in this video we have discussed skin to skin, various breastfeeding positions, how much and how often to breastfeed, uh, how often to breastfeed. So and baby's hunger cues. So this is this is about it. So we've come to the end of this video, and I hope that you have enjoyed it as much as I did. And thank you all for your time, and please stay tuned for more information on breastfeeding. Have a good day.